Back to Great Day. Do you wake up in the morning after a full night's rest and still feel tired? It could be a sign it's time to get tested for sleep apnea. And joining us now is Dr. Anna Smith of Dentistry with TLC, which is short for Tender Loving Care. Thanks for coming on Great Day. We always appreciate having you on.
Thank you.
Talk to us, doctor, about the difference, if there is a difference, between snoring and sleep apnea.
There is a big difference between those two. So snoring is actually when your tongue clogs up your throat and you're struggling to breathe at night. More than anything, snoring is annoying. It typically annoys the bed partner more than the person it's happening to. Sleep apnea is whenever your tongue completely closes your throat. That's the deadly part. That's when you stop breathing, you're suffocating. Typically, you're silent at that point. Your bed partner probably might even think, oh, finally, I get a moment of rest here while they're quiet. They're finally quiet. But that's the problem, is that you're not breathing. That's what wears out your body, wears out your system, potentially leads to strokes, heart attacks, high blood pressure, all sorts of things. So they are two different things, but many times what starts with snoring becomes sleep apnea as we get older.
It always strikes me when you use, this could be, when we're not trying to alarm anybody, but it can be fatal and has been for some people, unfortunately. So how do you treat, is the treatment for both the same?
That's a great question. So the treatment for sleep apnea, there are a couple treatments. The most common one is this thing. It's the CPAP with the big mask, the hose. There are different types of masks that you can get. This is considered the gold standard. This is typically what your physician will tell you to try first. The problem with that is most people can't use it. They can't tolerate it. The reason most people who snore or are told they snore won't go get tested is because they know that's the end and they don't want that thing. So the good news is, whether you snore or you have sleep apnea, this is another option for you. This is an oral sleep appliance. It treats patients with mild, moderate, even severe sleep apnea, or just snoring if you haven't developed sleep apnea yet. You just put it over your teeth, go to sleep like it's a night guard. It helps hold your tongue out of the way, your jaw forward, so you breathe while you're asleep.
Wow. I've even seen there's recalls on some of those CPAP machines as well that people would have to deal with, not to mention the cleaning and all of the possible infections and things you can get out of it. I want to turn the tables a little bit and ask, how do you pay for the appliance?
So sometimes health insurance will help you pay for the appliance. Sometimes you have to pay for it out of pocket. Whenever somebody comes into my office for a consultation, we always look that up for them. If they have some type of health insurance, we'll see if there's a benefit for them. If not, I actually have big discounts that I get from companies because we provide so many of these. You won't have to pay that big insurance price if your insurance does not help you pay for it.
Good to know, Dr. Anna Smith. For more information, well, thank you again. Always good to see you. For more information, please attend one of the following free seminars. Tomorrow at 1:30 in the afternoon at Limelight Events in St. Peters, Missouri, and then Wednesday in Fairview Heights, Illinois at the Holiday Inn at 6:30 in the evening. And then on Thursday at 6:30 in the evening at Comfort Inn Suites in O'Fallon, Missouri. And now Dr. Smith is offering $1,000 off the cost of a sleep appliance. That's through December 22nd. To schedule a consultation with Dr. Smith, call at 618-466-9263. Or you can visit cpapsucks.com.